I do think we are going into a severe respiratory virus season. Even, we will be seeing more cases of flu. I mean, really, we know that's coming. We know that there's going to be continued cases of COVID-19. We don't know how big this new wave is going to be, but it is coming. We're also already seeing huge numbers of RSV. On top of that are all of the other common cold viruses that we don't talk about as much, the rhinovirus, other coronaviruses, just all the regular viruses that we see on a regular winter year.
Most recently, with Omicron, the subvariants that are now becoming more pronounced in the population, unfortunately, seem to be less responsive to a new kind of medication that we were using in our immunocompromised patients called Evusheld. Evusheld is a drug that it's actually a monoclonal antibodies that you get like a vaccine, but it's not a vaccine. It's to prevent you from getting COVID. That said, within our clinic, we're still recommending that our patients who are due for their 6-month sort of booster of Evusheld go in and have that done. There's a variety of variants that are out there, not just the subvariants, and we feel as though it's worth having some of this additional protection.
The things that we can do to protect ourselves are the things that we've already been doing for COVID. It's about avoiding people who are symptomatic. And if you are symptomatic, really staying home and not going out and not exposing others, even if you have a negative COVID test. It's about wearing a mask when you feel it's appropriate. So when you're in crowded places, that's a good opportunity. In addition to masking, vaccination is crucial. So getting your flu shot, getting your bivalent COVID vaccine, these things will really help prevent infection, they'll reduce transmission, and potentially save lives.
Now, there's a lot of holiday travel going on. Wear a mask when you're traveling. I know that a lot of people, I've done a lot of traveling lately, and I see people in the plane and in the airports, and no one is wearing a mask. And I will tell you, that somebody on that plane has COVID because they've been traveling, they got exposed. Some people go onto the plane when they're symptomatic these days. So I think it's very, very useful to wear a high quality mask in those settings.